healthcare workers getting sicker from coronavirus than other patients, expert says. It remains unclear why the novel coronavirus seems to hit healthcare workers harder than it does other sufferers, an expert said Monday. We know the high mortality in older people, but for reasons that we don't understand, frontline healthcare workers are at great risk for serious illness despite their younger age, said Dr. Peter Hotez, dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston. There's nothing more destabilizing than healthcare workers falling ill, he told CNN, and it will take time to determine what is making them sicker than other patients. Hotez's words came following a weekend in which the American College of Emergency Physicians said 2 doctors suffering from the coronavirus were in critical condition. A Washington physician in his 40s and a 70-year-old in Patterson, New Jersey. It wasn't certain whether the Washington doctor contracted the illness through work or community spread, but he complied with all relevant protocols, ASEP said. The New Jersey doctor, an emergency preparedness specialist, was admitted to a hospital with upper respiratory issues and was isolated in an intensive care unit as of Saturday, the AECP said. I am deeply saddened by this news, but not surprised, ASEP President Dr. William Jacqua said. As emergency physicians, we know the risks of our calling. We stand united with our colleagues. Dr. Li Wenyang, the Wuhan Central Hospital physician who was hailed as a hero for trying to sound the alarm about coronavirus, even as police accused of him of rumor-mongering, died within weeks of being exposed. After notifying his classmates of 7 patients who were quarantined after being diagnosed with the coronavirus in December, the whistleblower died from the illness February 7. At the time, the number of cases in China had just topped 31,000. They now stand at more than 170,000 worldwide. Maybe it's due to a higher dose of virus they're receiving, Hotez hypothesized in his Monday interview with CNN. We don't really know. It'll take time to study. Coronavirus containment and treatment is already taxing governments and hospitals the nation over. Having healthcare workers sidelined and unable to care for patients presents a conundrum for which there is no plan B at this point, Hotez said. We have to do something to give frontline healthcare workers an extra level of comfort, he said. CNN's Alison Camerota and James Griffiths contributed to this report. Click subscribe to receive the latest news.